Toddler. I run the West Yorkshire Sling Library, and we're going to look at how to safely do a back carry with an Ergobaby 360 standard edition or position with the velcro waistband. So let's use the loudness. When we are using the Ergobaby 360 with the velcro waistband to carry a baby on the back, we need the buttons to be on the black carrying position, and we're going to place the waistband around us and try and get it as snug as you can. If you're using a buckle waistband, we'd often give a little bit of slack inside the waistband before we twist around to the back and tighten it later, but it's much harder to tighten the velcro waistband after the fact. So we put it on nice and snug and give it a wiggle around to the hip just there. So we're going to use the carrier to pass the baby around underneath the arm and onto the back safely without taking our hands away from them. So we'd usually suggest back carries be done with a baby from 6 months plus and sitting independently. So make sure that your baby's at the age and stage that you need them to be at. So making sure that all the buckles are done up as they should be and they've gone through the safety elastic. We're going to open the carrier into these 2 large loops, and you can make them reasonably long, but we don't want to take these too short because they're much harder to find and grab after the fact. So I'm going to pick up the baby and we're going to sit them on the side. So we can find that the middle of the baby's back is on the middle of the carrier, and it's kind of sitting them on the hips. It's quite a normal position for them to sit in, and we can guide the carrier onto the back. So you can see it is coming nice and high up on to offer support up to the back of the ear if you can, but it's perfectly okay for older babies to have their arms, either both arms or one arm, out of the top of the carrier, at which point we need a minimum of support to right up underneath the armpit just there to make sure there's enough support for the torso. So I'm going to put this dolly around with one arm out so you can see what that might look like in both cases. So once we're in on the side, we're going to take hold of the 2 padded pieces of the straps, holding them both in your right hand or both in your hand in front of baby's chest, just like that, and the other hand will sit on baby's bottom here. Now when my hand's holding these, I'm just making sure that my thumb meets my fingers and I've got a good solid grasp on the carrier there. So baby sits in, we've got one arm out, which is absolutely fine, and I'm going to give them a wiggle around until I run out of space. I can't get them any further around, at which point I take my hand off the baby's bottom and I'm going to bring it down underneath my hand that's holding the straps. I don't want to go through the first loop, but I do want to go through the second. So I'm going to go under the first loop, under my hand, and through the second loop. So the baby's held nice and securely all the way around. So I'll take my arm back through so you can see that again. I want to go under the first strap, through the second under my hand. At which point I can take over the job of holding the straps nice and firmly with my other hand. And popping a thumb inside the waistband, we can rotate baby around onto the back, nice and snug. So we're all held nice and securely. As we bring the other hand up, we're going to separate the straps out to make sure that they're sitting where they need to sit. One is already on my arm, and the other one I can guide my hand through, keeping them nice and tight by pulling them away from the body all of the time so the baby's held onto nice and snug. I'm going to tighten these up now, holding here, just going to pull back and down and back and down, and I can do up my chest belt on the front. Always remember that your chest belt will tighten up and it will move up and down on the straps as well, so you can put it at a good place to you. You can finish the tightening process to make sure baby's nice and secure on there. So this isn't working for me in terms of its fit, so I'm going to move it up a little here and up a little here on the straps so it feels more comfortable. Another trick that we can do, you can see that the knees are slightly lower down than the bottom here. I'm just going to reach into the back and just give my baby a sit down, just lifting the knees and tilting the bum towards me. And even with the doll, you can see that wraps the weight around the carrying adult a little better. Now the carrier is always going to be at the level that the loop allows for, and it's a reasonably long loop on the Ergobaby 360 with a velcro waistband. So it's not always the highest of back carry positions, but it's perfectly safe to get baby up and down into this carrying position by yourself if you can just remember where your hands go then it works fine. And we can do the exact opposite when we take the baby down. So what we're going to do there is we're going to hold on to the padded piece of the carrier and loosen the carrier by pulling that out gently, just there. I'm going to do the same on the other side, just gently, just there, to loosen the carrier off, at which point we can lean forward a little if you'd like, undo your chest strap, and we bring one arm out and down, already holding on to the padded pieces and making sure my thumb meets my fingers, coming down, down, until I can take over the job with my hand, bring it down and round, and my arm through, baby back round to the front, carrier comes down, and they were safe all the way up and down. I hope that helps.